Hey guys, Rose Pants here, back with another highlight from the Pot Book, a complete guide to cannabis. Super compilated book covering pretty much everything, edited by Julie Holland. Today we are continuing on with part 3 of this book, chapter 28, Pain Management. Written by Mark S. Wallace and Ben Platt, and they are both MDs. The beginning of this chapter just points out that it was in the 1980s that more research was focused on cannabinoids, and then in the 1990s we discovered the cannabinoid receptors now known as CB1 and CB2. It was because of all of this that led to a surge of preclinical and clinical studies to assess the therapeutic potential of cannabis. I pointed this out in the beginning of this series when I first kicked it off, and it bears repeating. I am not a doctor, I am not a scientist, so when it comes to some of these scientific words, I don't pronounce them so well or correctly. So yeah, I do it to the best of my ability, and I apologize. Can't even pronounce that word. I apologize if I butcher any of them. The overarching theme of this chapter is clinical studies on cannabinoid analgesia. On pages 328 continuing on to 329, they do say human studies must be interpreted carefully as there are several variables that can affect the outcomes, such as the routine administration, oral or inhaled, the drug studied, synthetic delta-9 THC, other synthetic cannabinoids or inhaled cannabis, and the dosages used. Other factors include the study design and whether it involves experimentally induced pain or clinical pain, because obviously those are two huge different types of pain. For the studies of clinical pain, it breaks it down into subsections, starting out with cancer pain. One thing about these clinical studies is that literature review identified only 14 studies actually using a randomized, double-blind, placebo-controlled design, which of course is like the top-tier type of study. Patients with cancer were the first to be studied and have been studied the most overall. And the results showed pain relief is significantly better than placebo at dosages of 15 and 20 milligrams. But they also noticed that the dosages produced substantial confusion and sedation as side effects. THC at 10 and 20 milligrams was found to be equally analgesic to 60 and 120 milligrams codeine respectively. Again, 20 milligrams THC produced unpleasant drowsiness and mental cloudiness, but 10 milligrams THC was relatively tolerated. In my opinion, the findings of this study are huge because it shows that not only does cannabis have that positive reaction to the patient, but you need a lower dosage than you would with a normal pharmaceutical such as codeine. Next is neuropathic pain, which is a type of chronic pain that is caused by abnormal nerve function in the peripheral or central nervous system. And common causes include diabetes, shingles, alcoholism, and HIV, among others. For this, the synthetic cannabinoid CT3 was studied on 21 patients with chronic neuropathic pain and was compared to placebo. Patients received 40 milligrams for 4 days and then 80 milligrams for 3 days. The CT3 provided significant pain relief at 3 hours compared to placebo with less of a response at 8 hours. Side effects included mild dry mouth and sedation. Obviously, you're going to want to take something that's going to help you in 3 hours rather than 8 hours. The only clinical study done on inhaled cannabis evaluated its effects on neuropathic pain attributed to HIV, where 50 patients smoked either 3.56% THC cannabis cigarettes or placebo cigarettes 3 times a day for 5 days. Smoked cannabis significantly reduced pain by 34%, compared to 17% with the placebo. Next, they talk about acute pain, which is a normal neural response to some sort of painful stimulus, generally either an injury or surgery. For this study in specific, it was a synthetic cannabinoid used compared to placebo on 56 patients with acute pain. 4 different intramuscular injection doses of 1.5, 2, 2.5, and 3 milligrams all provided significant analgesia, but the authors were unable to produce a significant dose-response curve. Side effects were mild, with drowsiness being the most frequent. Even if this study didn't have the most conclusive ending, they weren't able to make that dosage curve with the different doses, 1.5 to 3 milligrams, but they still had positive finding in the end, and that speaks a lot for itself. Next is chronic pain, which can be due to either neuropathic causes, which we've discussed before, or nociceptive causes, such as arthritis. Sativex was used for this study, and it produced significant pain relief with movement and at rest and improved quality of sleep, but it did not decrease morning stiffness. For me, this finding just kind of comes down to common sense, common knowledge. If you are sleeping, you're out for like 6 to 8 hours, and then you wake up and you've got this morning stiffness. Like, how is the cannabis gonna help you if you hadn't taken it? You know, like, obviously, I feel like if they took the cannabis right after waking up, wake and bake, hello, they might not have that problem with morning stiffness any longer. But if you're asleep and you're not ingesting cannabis, and then you wake up, yeah, your arthritis might bother you. The next subsection they discuss are headaches, which I'm pretty sure every single one of us can relate to. Page 333 in the pop book, they even do kind of confirm references on the use of cannabis for the treatment of headache date as far back as the 6th and 7th centuries. However, after cannabis was dropped from the US pharmacopoeia, the reports largely disappeared. Preclinical research has suggested that cannabis may have a role in the treatment of migraine through inhibitory effects on serotonin type 3 receptors and by blockade of serotonin release from platelets. In addition, the cannabinoids bind to areas of the periquadactyl gray matter, an area of the brain that modulates pain transmission, where the opioids work to relieve pain, which has been implicated in migraine generation. So even though this is like the most widely documented type of pain, there are only 2 references to the use of cannabinoids for the treatment of headache in the 20th century. One of them reported on 5 patients who used cannabis to treat painful conditions, of whom 3 had chronic headaches, and all 3 reported relief that was comparable or superior to aspirin. The last section that they discuss in this chapter is reports on smoked cannabis. In Canada, a study of 30 patients who used medical marijuana at a pain center found that 93% of patients reported a moderate or greater pain relief, and side effects were reported by 76% of the patients, and they included increased appetite, weight gain, and slowed thoughts. You know those commercials for pharmaceuticals nowadays, how they have at the end the really fast-talking guy that's discussing all of the side effects and how horrible they sound? None of them are as mild as increased appetite, weight gain, and slowed thoughts. These are like things that are gonna physically kill you, like liver damage or kidney failure, like thoughts of suicide. Cannabis is never going to do any of those things. But in conclusion, they say on page 335, pain is difficult to study because it is a subjective experience that is affected by many aspects of a patient's life. However, preclinical studies have demonstrated that cannabinoids have analgesic activity similar to other analgesics, such as opiates. However, the clinical studies are inconclusive and suggest that there may be a therapeutic window of analgesia. This stresses the need for further research on the analgesic effects of the cannabinoids. As long as the medical use of marijuana remains legal at a federal level, the true analgesic potential of cannabis may never be known. But mark my words, it will be known. always, at the end, after we've fed our brains with cannabis knowledge and cannabis news, we can feed the rest of our cannabinoid system with that good green cannabis itself. Thank you guys so much for joining me for another highlight of the pot book. Next week we'll be moving on to part 4, which is cannabis culture. Next week's highlight will be another 2 for chapters 30 and 31, what to tell the children, and pot parenting and outing myself. Bye.